Welcome. Welcome to the Ocean Springs Community Podcast. I'm Cynthia Sutton.
And I'm Tristan Ruppert.
And we are here today with Lee Bond, the CEO of the Singing River Health Systems.
Lee, how you doing today, man? Obviously a lot of long hours, I'd imagine, these last few weeks, man.
That's okay. We're tough. I'm good.
Awesome. Well, I know you have been really, really busy. So let's get started with telling the community, Lee, if you don't mind, just give everybody an update where we are now. We're like way beyond 40 days in. Tell us a little bit about where we've come from and where we are now in seeing the cases.
Okay. Well, that's actually just about right. We I think day before yesterday marked the 40-day and 40-night mark.
Wow.
And on that day, we actually had a day, our first day since I can remember, where we had 0 positives reported, and that was a very happy day for us. We did have 9 reported yesterday, unfortunately, but still, if you look at the rolling average and where we're at on the slope from a calculus graph standpoint, we are still trending a little bit downward now, so that's good. It looks like we might have peaked before the rest of the state. I think that's a testament to our community. We just got off an all call with law enforcement and Earl Etheridge and the county administration, and I think that everybody working together, the mayors, et cetera, getting the word out, communicating with people. I think we smashed the curve a little bit before others did.
Well, Lee, can you make sure your video is on real quick as you're talking?
My video?
Yes.
No, his video is on. He's just using the phone audio, which is why every time he speaks, it goes to the phone logo.
Awesome. Okay. Sorry about that. Go right ahead.
You can see me? Can you hear me?
Oh, yeah, we can hear you. We can see you. We're all good, Lee. As you said, it seems like at least in South Mississippi in particular, Jackson County has seen a little bit of a decline. What's that been like for the healthcare workers on the front line, seeing that all their hard work seems to be making somewhat of a difference?
It is making a difference. Unfortunately, our hospitalizations aren't really going down. We've had a local nursing home that's had a few challenges, and so our number of cases, for example, right now we've got, I think, 18 people that are inpatient in-house, and so it's not a big relief, so to speak, still having those in. We are getting, as I said earlier, more negative outpatient results. So we're on the downhill slope community-wide, but within the hospital, we still have quite a few on. I will say the one thing that's been good is we've got less people that are on the vent, less people that are in the ICU, and so that's a positive for sure. But it's still very difficult for the folks that are on the front line. Just having one patient, you have to have the full PPE, you have to have the full clinical protocols in place, and all the challenges that come with it. So it's still pretty tough for them. They probably haven't really felt a ton of loosening on that end yet, but it's coming, we hope.
Awesome. Well, tell us a little bit also, because we're on the downhill slope, but you guys are still testing every day, right?
We are. We're testing a lot of people every day. We've done over 2,000 tests to date, and all of our clinics throughout the county, they are drive-in every day. If you dial the 809-5044 number, you can do a drive-through at any one of our clinics throughout the entire county. There's been a few, stunts to do. We've got a drive-through testing by some other places, but ours are drive-through every day. Just dial that number, and if you've got symptoms, they will hook you up.
And I have a question. So if they have symptoms, do they have to have all the 3 main symptoms to be tested?
No, not necessarily. We have a physician that will, or a provider that will answer. It could be a doctor, it could be a nurse practitioner, depending on the time. But when you call it, they'll walk through a series of questions, and you don't have to meet all of the criteria, but you do have to meet some. For example, if you've got a fever and you haven't come in contact with anybody else, and the fever is a low-grade fever, they're probably going to tell you, and you have no other symptoms, no cough, no shortness of breath, no comorbidities, and are below an age requirement, then they're probably going to tell you, look, just wait and let's talk again, after a few hours or tomorrow.
Okay, awesome. Okay, so what should some of, if they think they've been exposed, they've been tested, tell me what that next step is.
So if someone has been tested and they are waiting on test results, they need to quarantine and isolate at home. It is actually the law. The health department will give them notice, and we've been trying to help the health department by going out ahead and sharing that with
Wow.
people, that information. But if you are pending test results, you are supposed to self-isolate and quarantine at home. And we've had some, there's people that are, obviously people need to work if they've got a job right now, but that is part of the reason for the legislation, is so that they can actually, still be paid and get compensated. So.
Lee, obviously we understand that a bunch of nurses and people on the front lines are dealing with this day to day. Take us through what you've been doing. I'd imagine it's a lot of communication, really just making sure everybody's on the same page. What has your normal day been looking like, as much as normal really can be seen right now with the pandemic? But what has your day to day been like as the last few weeks?
Well, I can tell you that it feels like the new normal. I was able to take off a few hours this past Sunday, and it felt like I was off, or 4 hours felt like a week. So it felt pretty good. I'm hoping that our frontline team can get to that situation here pretty soon. But it's been tough. I mean, I will not deny that it's been a challenge. I see the strain on the faces of the people that are on the front line. It's whether they're an ICU nurse or respiratory therapist, or the environmental services workers, or the food service workers, or radiology, the lab, the facilities team, everybody on our team. We've got 2,500 and something people, and every one of them's a hero in some way. Everybody's contributing in some way. Could be the finance department and what they do, making sure we're staying afloat and staying open. It could be that person who's literally right there in the room with the patient. The things I see that are most amazing to me are the examples of a person, an ICU nurse, who's using her own personal cell phone to communicate with a loved one, because people can't come in the hospital right now because of the federal visitation restrictions. And so that's the most challenging thing. But I see people, there's silver linings in everything. And what I see in this, the silver lining I see, is that we have people that have truly risen to the occasion. I've seen our core value of teamwork. I've seen our core value of serving with heart and soul just absolutely punctuated. I've seen the benefit of our big, strong ICU team, probably the strongest we've ever had in history. Who knew that we were going to be in a pandemic situation like this? So we're pretty excited that we have been able to have these phenomenal doctors, Dr. Bobber and Dr. Wahid and Satala and Baral and Wilson. We're just blessed, really, to have that level of pulmonary critical care in our community. But I've seen them at work every day, and it's actually been amazing to watch those heroes at work.
And with those heroes continuing to step up each and every day, the community seems to have really risen to the task of paying their respects to, their sacrifice. What's it been like for you to witness? It seems like every other day there's some kind of tribute, some kind of touching sign of respect being handed out to those on the front lines working. What's that been like for you to see those heroes be honored?
It's been very humbling. We had the prayer vigil that they did. That was one of the strongest. I firmly believe that the Holy Spirit is strong here within these walls, and that was the most moving moment of all. We've seen churches, we've seen foundations, we've seen Chevron, the power company, Baco McCarty Foundation do big things. We've seen small things. We've seen people drop off a dozen masks, somebody that just happened to have them in their garage. We've seen people bring 3,000 masks. We've seen Coca-Cola and other local restaurants and people bringing food, and it's just been absolutely overwhelming. We love our community, and they have absolutely stepped up in a big way to give an outpouring of love to the people that are out there fighting this war on the front line.
Wow. Well, let's move to a hot topic, the economy. The economy, with the economy slowly possibly beginning to reopen, what are your thoughts on that related to a medical standpoint?
So we are strongly in favor of reopening the economy, actually, and some of my other healthcare CEOs might not be completely in line with me on that, but I do believe that the longer that we stay closed, the worse it's going to be. I believe the medical and mental health challenges that it's going to cause people are going to be extremely large, and I don't think we're thinking enough about that in the future and what that can do. But I will tell you that we do believe there should be some restrictions. We actually are confident that we meet the phase 1 requirements of the federal plan, the Trump plan, whatever you want to call it, and we're sort of geared towards that. We've had some good communication with the folks at the county about our thoughts on it, and we've talked to the governor's office and the federal legislators and state legislators about it. We're 100% in favor of opening, but we believe there needs to be a few things. For example, if we run out of personal protective equipment, we are not going to put any of our healthcare team members at risk. And if that were to happen, we would recommend immediate reversion. We are going to require, we have the largest employer in the state right here in our county with Ingalls, and we want to keep them, being able to operate. And in order to do that, we have to have the rapid testing allocation from the state, and the state health department's working well with us on that. We need to make sure that we have a situation where law enforcement has the ability and the support to go out there and educate the community when people are having social gatherings. We would have no problems reopening if the few folks that are positive or pending positive would comply with the law. It's actually the law. If you have this, you are supposed to stay home and isolate. And that's the problem, is when somebody's positive, if that person goes out in public, that's where we have the problem. And so we're 100% in favor of reopening, but we believe there needs to be serious attention paid to those people that are not being compliant.
Now, Lee, you brought up Ingalls, the largest employer in the state. What's y'all's communication been like on a day-to-day basis with them? Obviously, they've had some examples, some issues there, but they seem to be doing better. It seems they've been reporting fewer and fewer cases. What's y'all's communication been like, and how did y'all really go about addressing them to make sure they were staying safe, but at the same time they were reaching out to you, obviously, to communicate and promote not only communication, but safety?
So we're working hand in hand with them. They have a physician out there, Dr. McCraney, who leads their on-site clinical efforts, and we work with them and the folks over at their QuadMed clinic too. But we basically are talking with them daily. We have set up out there a pre-screening with Jason Ely, who's over our medical clinics, has set up sort of like a mini screening testing spot out there. So we're having a couple of days that, through the screening we're testing, but so far, you're right, the test results have looked pretty good out there. And what we have found, interestingly, we started this project, we call it our Navigator Epidemiology Project, where we've assigned some nurses to basically follow each person. And what we've learned from that is that people at work tend to not let their guard down. People at work are paying attention to, not touching their face and washing their hands. But when they're at home visiting with family, they're more relaxed, they're sharing cups, cell phones, countertops, dishes, and things like that, and hugging each other or touching each other and not washing their hands as often, and that's where they get it. But anyway, back to Ingalls, we've had a great relationship with them out there, and hope to keep them rolling.
Awesome. Okay, so on that vein with the businesses, as we begin to open up, we've had a lot of businesses, call us at the chamber and just ask, do we wear masks? Do we wear gloves? Do we make our customers wear masks, gloves? What kind of precautions should they take as we move forward with this?
The most important thing I can tell you for any business, if a person comes into work and they cough, they need to go home. And they need to stay home until they have zero cough. That is more important than a mask. If you have a person wearing a mask who is coughing, working, they're going to inevitably, sometime during the day, they're going to touch that mask to adjust it. And you know what's going to get on their hand? COVID-19. And they're going to touch a countertop that somebody else is going to touch. If someone is coughing, they should not go to work. even a little, even if they think it's allergies. If you are coughing, do not go to work. That is the best advice I could give. That's 1,000 times more important than the mask. That's how it spreads, mainly. People coughing and getting it on themselves and touching something else or somebody. That is the number one way. So that's the main advice I would have for businesses. I mean, as far as the mask, I mean, certainly a mask helps when worn properly. If you look on TV, you see people, wearing them all different kinds of ways. You should educate people on the proper way to wear it, the proper way to clean it, the proper way to avoid touching it, to really wash your hands literally every hour or every time you touch something someone else may have touched. Things like that are also important.
Awesome.
Overall, as businesses continue to open up, are there any tips that you would like to provide? I understand, if somebody's coughing to send them home, but is there anything else that, because many small business owners are concerned about opening up too quickly, is there anything you can say in regards to how they can better protect themselves and their customers?
The biggest thing is people have got to step up and be, selfless in this, and they need to inform their team members, look, if you've got a cough and you're not getting your hours, some businesses, not all, you need to look and see if they qualify for the funding that they can get, because that's what we've seen a little bit of, again, is people that feel like they need to go to work because, people need the money, they need to pay their bills. But if they can take advantage of those federal funds in some way, I would ask them to really focus on that, because it's not worth it to have someone come to work and infect 1, 2, 3, or 4 other people, because you never know if that person you infect is a person that's immunosuppressed or is older. That could end up leading to death. So it's got to be taken very seriously, and we've got to be, as a county, as a city, as a nation, putting other people ahead of ourselves right now and thinking about other people and not thinking about ourselves. So that would be my advice, is to be selfless and think about other people. And the businesses can emphasize that to their team members. Again, I'll say it again, if they've got someone that's coughing, they should not be at work.
Right.
No matter what.
And we have some folks, watching that are asking some questions on Facebook. So we want the audience that are watching to continue to ask some questions. And you kind of answered this one, but just in case someone asked what to do after being tested. I know you said, to stay home, but kind of what's that process for them? How long is it going to take?
So if you've been tested, it's a period of anxiety, and it's tough. We're able to get our tests back almost 100% of the time within 24 hours, faster in some cases. But I would say that if you have been tested and you're waiting on your results, act as if you have it. Assume that you have it. Don't come in contact with other people, and keep your hands washed. Don't touch your face. Try not to spread it. Wear a mask if you think you have it, especially if you've got to be around someone else in that particular case. But the other thing you can do is, if you haven't been through our system, you can dial the 809-5044 number, and we can connect you directly with a provider who can give you some specific medical guidance depending on what your symptoms are. There are some people that during this process need to be admitted to the hospital. Mm-hmm. And our emergency rooms are open, our clinics are open. They're very clean. They're probably the cleanest environments you can go to. And I'm not saying that to try to drum up business for them. I'm saying that because we've had a few cases where people are scared to come into one of those facilities, and actually those are the most sanitary, clean facilities you can probably come in on the coast, cleaner than most houses. And so I would encourage someone not to let themselves get in a bind, to come in and let the medical professionals help you. That said, if you get the test back and it's positive, in most cases, in fact, in 90% of the cases, you're going to be able to ride this out at home by staying hydrated and following your doctor's orders. And probably you're going to have to do that for 14 days to be sure. Even if your symptoms go away the next day, you really need to, from the day you had those symptoms start, you must isolate for 14 days.
And I did want to touch on that. You did say they'd be able to ride this out at home. I think there's over close to 2.5 million cases in the world now. Overall, I'd like to get your opinion on this, how we've handled this as a, unit worldwide. Do you think we've had a good response overall? It seems like you said, we're starting to see some areas in the country kind of flatten the curve. Some haven't had that success yet. What has been your reaction to how we've handled it worldwide?
Well, I believe most people are good, and I think that people have tried. And every night when I get home, I watch just a few minutes of CNN and a few minutes of Fox, so that I see a fair and balanced view of what the world is saying. And I watch sometimes a few minutes of ABC News, and it does make me sad that every time that any of them start, no matter whether they're on the left or the right, they always start with how, this person has failed and that person has failed, how the governor of New York's failed, how the president's failed. I think that's a shame, and it makes me sad, because I think that most people have tried very hard to do the right thing and figure this out. And I think that nothing like this has happened in our lifetime. And I think it's a testament to the good in humanity that people have banded together to try to help each other for the most part. Yeah, there's a few isolated situations where things could have been different. And I think there's some people that probably could have worked harder than they have to help thwart it. But overall, I think the response has been good. I'm particularly proud of here in the county. Again, I had a call earlier with all of our law enforcement and Earl Etheridge in the county, and I think that we are a good case study on how everybody put aside political differences. Everybody has banded together, in my opinion. And I think when this is done, you're going to see that while we had one of the highest rates of cases in the state, that's because we are a industrial working community. And I think that we sort of busted the curve before we got to the peak, and we peaked before the rest of the state. I think there's a reason for that. So I think locally, from what I see, I think the response has been very good. And I think that people that are being critical of all of these elected officials, it's easy to criticize, but, what I want to say to a lot of them is, what have you done? I want to say that to George Stephanopoulos when he says, well, this one's done this wrong, well, what have you done, George? All he does is complain. So I'm sort of tired of hearing people talk about all the bad. And I'll also say this, it has been terrible. There have been people that have lost the battle with this disease, but ultimately we're going to win the war on this. This is America, and we are a great country, and it has been terrible. But you look, Sarah's got a graph that shows people are like, oh, the United States has the worst case. We've got a higher population. We're a ton bigger than Italy. Anybody that says it's crazy that we have more cases than Italy, I think is a moron. That's ridiculous. It's the fact is, I think the United States has responded fairly well to this. Overall, I'm proud of what our county has done, and ultimately, we're going to win. And there's not enough stories about the healthcare heroes on the front line, not just here, but everywhere along the coast and throughout the country. There are people that are making enormous sacrifices, and you don't hear any of that on any of those networks. Every now and then they'll throw a little blurb out here and there, but almost all of their focus is on what everybody's doing wrong. I wish they would do more, and that's why we try to promote our heroes here, because that's important, and that message isn't out there enough by the media.
And you guys have done a wonderful job keeping those spirits up and helping the community in general, working with them and all that you guys are doing. There was a wonderful video a couple weeks back that was kind of done between the two hospitals where all you guys came out on the top of the building. I got teary-eyed at that point when you just saw all of you guys working so hard.
That was
y'all were
that was a part of our
say, right? Y'all were saying thank you to the community, when all we need to do is say thank you guys. I guess with that being said, do you have any closing remarks, Lee?
Yeah, I would just say again, if there's one thing I could do, it's to say a huge thank you to all of the team members that we have here. I could not be more proud of their grit, passion, and commitment in our mission to improve health and save lives. It's been awe-inspiring to watch, to feel them. Not one person has complained the whole time about anything They are, I call them our fearless warriors. We've had people going from one hospital to the other. Not a single person has not been up to the challenge throughout this. So I just mainly would like to say thank you to the heroes that work here. That's the main message I've got, and to tell them to stay Singing River strong, and we're going to get through this. We're going to win the war.
Well said. Well, thank you to all those frontliners, and thank you, Lebon, for taking time today to give the community an update. And we have this on Facebook, and anybody who has any other questions, let us know, and we'll keep you guys informed. And thank you always, Lee, for keeping us in our communities, the city government, the chamber informed. Thank you.
You're welcome. Thanks a bunch. Have a good day.